name is Michael Kambars, and today we will be presenting SARS-CoV-2. My fellow presenters are Malachi Aviles, Kylie Clements, Alexander Korb, and Sloan Miller. Okay, SARS-CoV-2 is also known as the coronavirus or COVID-19 in layman's terms. It is actually only one type of coronavirus. There are actually several that are known to mankind, and the current COVID-19 strain has actually been shown to mutate fairly rapidly, so there are many strains out there. Three specifically are important to global health, one of them being MERS, which is Middle Eastern Respiratory Syndrome, is also a coronavirus. And of course, there's also SARS-1 and SARS-2. SARS-CoV-1 and SARS-CoV-2, excuse me. And as the name suggests, they're part of the Coronaviridae family, which get their names from these coronas, or crowns in Greek, which basically are these special proteins that help the virus gain access to the host cell. And SARS-CoV-2, as some of you probably know, is responsible for the second SARS epidemic or pandemic now in the world. Some anatomical pathological characteristics of SARS-CoV-2 include, as previously mentioned, these special glycoproteins on the exterior of the viral envelope that are called coronas or crowns, which are actually spikes. They're known as spikes that allow the virus to gain access to the cell. And this is characteristic of envelope viruses such as SARS-CoV-2, SARS-CoV-1, etc. So basically, enveloped viruses are able to gain access to the cell by fusing with the cell membrane and allowing the capsid to come into the cytoplasm, where it proceeds to wherever its destination is in the cell, whereas non-enveloped viruses require disruption of the cell membrane in a certain way. SARS-CoV-2 is also a respiratory virus, so this basically means that it targets organs such as the lungs and even the heart in some circumstances. So it could be said that SARS-CoV-2 also targets the cardiovascular system as well. It has been shown to target the pericardium in some ways, but mainly the alveoli in the lungs, which, as you can imagine, would disrupt lung efficiency and capacity. This is one of the reasons why asthmatic patients or patients with emphysema or other respiratory illnesses may be at higher risk of worse symptoms. The SARS-CoV-2 outbreak was very different than the SARS-CoV-1 outbreak of 2002 to 2003, which was rapidly contained by the Chinese government. Was also a zoonotic virus from China, which began with animal handlers around 18 years ago. And the SARS-CoV-1 outbreak had a much higher mortality rate at around 6.5% versus current statistics in SARS-CoV-2, which report around a 1 to 2% COVID-related death rate. And now we're going to move on to origins.
As previously stated, the severe acute respiratory syndrome is not a truly new virus or disease we've not experienced before. As stated, in 2002 and 2012, there was an outbreak in Middle East and China, but these were contained in their respective areas and stopped relatively quickly. But an interesting thing of note is that these two previous outbreaks, along with our current one, have remarkable similarities to a near identical virus that is known to spread throughout bats. And therefore, it can only be assumed, due to the rapid spread of the disease, that the origin of the coronavirus came from bats. And how did a bat disease become infected in humans would be through the lower hygiene standards of lower income status areas, like in the city of Wuhan in China's Hunan seafood market. And in there, it is much easier, if not regulated as tightly, for bacteria, other compounds to just integrate into other people's food as they're bought because things aren't cleaned. And if a dead bat with SARS-CoV-19 just happened to be around there, it would be easy enough for someone to eat it, sell it, or for it to contaminate the other seafood that's being eaten. However, this is just a theory because no patient zero had been identified. By the time people had recognized this as a unique virus and not just an epidemic of pneumonia, it had been too late, and far too many patients had acquired this disease. As stated, The Wuhan pneumonia epidemic was also silenced back when it first started in December 2019, which further made finding an origin of patient zero near impossible because China would not want the world to know that they were dealing with another pandemic of pneumonia, no less. Weakness cannot be shown. And as the spread continued to occur, people began to realize that this was not just a mere case of pneumonia, because pneumonia is the symptoms, not the actual disease. Well, it is a disease, and therefore there had to be something being spread here between the people. But by the time they realized that, the silenced pneumonia epidemic had more than 4,000 immigrants leave from China throughout the world. And who knows how many of those 4,000, if not more, were carriers and already infected. And as such, the next case of this mystery pneumonia was identified in Thailand on January 8th, 2020. And unfortunately, the World Health Organization, WHO, finally realized what the cause of this mysterious disease is as more than just mystery pneumonia. And on January 11th, 2020, it was officially recognized as a new strain of the SARS coronavirus, dubbed COVID-19 for short. And those 4,000 immigrants, so whoever had it on there, they began spreading globally this lovely new disease worldwide, and an international state of emergency was quickly announced.
So today I'm going to be talking to you guys about the different vaccines. Currently in the United States, there are 3 authorized COVID-19 vaccines. The CDC does not recommend one over the other. It kind of just depends on which one is available at the time, and that's the one that you will receive. And the CDC has stated that you will be fully vaccinated 2 weeks after you receive your last shot. So the Pfizer vaccine is 95% effective, which is really good. And in order to get this vaccine, you must be at least 16 years old. You will be given a total of 2 shots, and the 2 shots have to be given 21 days apart. It can't be any less than that for reasons. And this type of vaccine is an RNA. So the Moderna is 94.1% effective. This is an mRNA vaccine, and this one requires you to be 18 years old and older, and you will receive 2 different shots, and you will be given those 1 month apart from each other. And all of the vaccines have some side effects. With the Moderna and Pfizer, the side effects were mild, and some of those included swelling at the injection site, chills, fever, muscle pains, tiredness, and a few more. The Johnson & Johnson vaccine is only 66.3% effective, and scientists are currently looking into that to see why it is so much lower than the other ones. For this vaccine, you have to be 18 years old and older, and you will only receive 1 shot. And the side effects were more common with this vaccine in people aging from 18 to 59 years old. Some more information is that with all 3 shots, you will receive your vaccine in your upper arm, in the muscle. And there are actually 2 more vaccines that scientists have been working on that are in phase 3 of their clinical trials. And the first one is AstraZeneca, and the second one is Novavax. So hopefully those will come out soon. And a lot of people tend to think that because you get the vaccine, that is a cure. That is actually incorrect. There is no cure for the COVID-19 virus. The vaccine will just help reduce your chances of catching the virus. And yeah, it's kind of like the flu shot, how you get the shot and it tries to reduce your chances of getting the flu, kind of like that. So I want to ask my audience if you are going to get one of the COVID-19 vaccines, and if you are or not, I would love to know why.
The transmission of COVID-19, according to the CDC, it spreads most commonly through close contact from person to person, and it's mainly spread through airborne droplets. It's inhaled or deposited into a mucous membrane, and that's when it causes infection. And some ways you can spread airborne droplets, for example, is this guy sneezing, coughing, talking, and things like that. And the CDC recommended you stay 6 feet away from someone because it is less likely to contract the virus when you're that far. The reason for this is, according to the CDC, that the larger particles will fall out of the air and the smaller particles will just disperse and won't be as problematic. So it's uncommon for COVID to spread on surfaces, and the CDC said that it can sometimes be spread by airborne transmission, but there's a lot of conflicting research. For example, a study by Harmik Koskin, however you pronounce that, said that it cannot be spread by airborne transmission, and that it's necessary for infected people to wear the masks. But at the same time, the same article also stated that the wind can cause an increase in cases by carrying the droplets further distances. So again, there's some conflicting research on how effectively it spreads via the airborne transmission. But the CDC also stated that in a non-ventilated room, poor ventilation, it has infected people further than 6 feet, and it has lingered in the air for a long amount of time. So they recommend that you stay in a ventilated room if possible. And current guidelines from the WHO and other healthcare organizations, the common stay 1 meter apart, so 6 feet. Again, this will help reduce the risk because larger droplets will fall out of the air. Outdoor gatherings instead of indoor. Outdoor, obviously, you're not closed in. It'll disperse the air. You don't have to worry about ventilation. And then avoid the 3 C's, they said, which is close, so anything with close contact, closed rooms with poor ventilation, or close, and contact. Wear a mask. Again, the article stated that it's really not only necessary for infected patients to wear masks, but this is what the WHO and other organizations are recommending. Increase ventilation if you can. Try and open windows. Make sure your room is ventilated when you're with other people. Practice good hygiene. Even without COVID, it's common sense. And isolate if you're feeling ill. Again, that's just part of being sick. You shouldn't be going out and spreading it. So yeah, that's how COVID spreads and some of the current guidelines. Thank you.
COVID-19 is just one of the multiple types of coronavirus, so the symptoms vary between each of them. However, they do cause mild to severe respiratory illnesses, or they can show themselves as asymptomatic. A respiratory illness could include symptoms like fever, cough, and shortness of breath. According to the CDC, symptoms of COVID-19 may appear 2 to 14 days after exposure. However, the average is around 5 days after exposure. Some of these symptoms are very similar to the flu, so if a patient isn't having any symptoms that differentiate between the two, testing may be necessary for a diagnosis. The most common symptoms include fever, coughing, congestion, difficulty breathing, headaches, body aches, new loss of taste or smell, nausea, or diarrhea. Taste and smell lost to COVID-19 have been reported to take months to come back, sometimes even 6 months or longer. Other symptoms include pneumonia, persistent pain or pressure in the chest, confusion, or bluish lips. Long-term effects are considered symptoms that last more than 4 weeks from the initial time of exposure. And the CDC is still studying the long-term effects of COVID-19, but some of these include depression, difficulty breathing, and loss of taste or smell. According to the CDC, people with underlying health conditions and also people over the age of 60 are at a higher risk of developing serious complications. 8 out of the 10 COVID deaths reported were people the ages of 65 and over. The fatality rate among the older population is much higher than the rest of the population, and they could need hospitalization, a ventilator, intensive care, and if none of these things work, they would be at a possible risk of death.